Welcome to Logical Ayurveda. Today, yet again, we have come up with a wonderful video. So, today's video is not only about teaching Ayurveda doctors and presenting the case study to Ayurveda doctors. Today's video is not only about giving awareness to the patient and telling patients that Ayurveda cures these diseases and giving awareness about it. Today's video is about relevance of Ayurveda in current day clinical practice and inevitability of Ayurveda, that how Ayurveda can never be written off, how Ayurveda can never be taken out of the table, and how Ayurveda will remain relevant in ages to come, had remained relevant, is relevant, and going to be relevant. So today's video is one such video. So before going into the video, I want you to imagine three situations and really go through the emotional condition of these three situations and patients suffering from them. Situation number one: you are a parent and your child is suffering from any form of developmental disorder or a milestone delay. And even after 3-4 years, the child is not able to speak any single word. As a parent, you're really frustrated. As a parent, the child meant whole to you, and you will give anything in the world just to make the child have a few bouts of development or just to make a child speak a few words again. Situation number two: you have a parent who meant the world to you, who is everything to you, who have given everything to you, and that particular parent, mother or father, is suffering from any form of progressive dementia or Alzheimer's disease, and he or she can barely recognize anyone, remember what place they are in, and it will mean great thing to you if she gets some form of result in that particular condition, and if she starts to recognize anyone and start getting her orientation back. Situation number three: you have a child who is having repeated fits of febrile convulsions, and she's getting treated with anti-epileptics year after year, and the dose is getting increased. Even after increasing the dose, the epilepsy is coming back, and the convulsions are coming back. So you badly want that convulsions to end. You cannot see your child having fits again and again, and you want to give great difference to the child. You wonder if this condition could ever be cured. So in all these situations, situation number one, developmental disorder; situation number two, dementia, progressive Alzheimer's; situation number three, repeated febrile convulsions. In all these conditions, with the grace of Saraswati and by kindness of giving Saraswatharishtam, I was able to give a phenomenal difference or cure in these three conditions and hundreds of such patients. I can tell proudly with the Ayurveda medicines, with the power that is given to me by Shastra, I was able to cure all these conditions. When I tell Saraswatharishtam, I mean to use only cortical, so please make sure to use that. And one more thing, one more interesting story before going into detail in developmental disorders, how I treat Saraswatharishtam. In developmental delay, I don't mean those muscular dystrophies. I only mean those speech and cognitive abilities. The children who is after 3 years old, 4 years old, cannot spell amma, appa properly, is having stammering of voice, is not speaking properly, is having this saliva dripping out of mouth, and they cannot speak properly. In such particular cases, I give Saraswata Churnam mixed with honey, 1 spoon or half spoon according to weight of the patient and according to the age of the patient, and Saraswata Arishtam 1 spoon or 2 spoon twice a day, and Brahmi Vati of Dudh Papeshwar I give. So Saraswata Churnam with honey, Saraswata Arishtam, Brahmi Vati, especially for speech disorders, for 1 year. Now let me share a very interesting thing that happened in my life that make me dive into Shastras and learn about Saraswatharishtam in detail. That was a hair-raising moment. That was really a heroic moment for in my life, and which encouraged me to do more and more Ayurvedic clinical practice. So there was a patient who came to me, and in my initial days of practice, I used to study Dinesh sir's Kaumarabhritya book and clinical practice, etc. From there, I learned more about how to treat developmental disorders, etc. So I have this patient, and 3 years old baby which cannot speak amma, appa, etc. And they come here. I give Saraswata Churnam, Saraswata Rishtam, and Brahmivati. I said continue this for 1 year and come back after 1 year. I never see this patient, and I ask the children to. I ask the child to speak. The child can barely speak one or two words. It's very stammering. It's feeling very shy. It's not having confidence, etc. So I feel very bad for this child. I give Saraswatharishta, Saraswatachurnam, Brahmivati, and left. And I left for 1 year. Fast forward 1 year. I'm entering the clinic as I'm going in the for morning practice. So I see this child. I barely remember. I've seen this child somewhere 1 year ago, and I give him medicine. I don't remember even for what. And the parent is sitting, and suddenly the child is telling, "Amma, doctor has come. Let us go inside." This whole sentence the child told to the parent, and I'm looking at the parent confusingly that for what I've treated. Doctor and the parent in the visiting cabin itself, they told me, "Doctor, she was unable to speak even a single or double word before 1 year. You gave such a wonderful medicine. This kid is telling me the doctor has come. Let us go inside." And I have a testimonial of the patient, and I swear by God, this is exact verbatim of what the situation happened. I'm not putting it even by 1% exaggeration. This is exactly what happened. And then I dove deep into Saraswatharishtam, and I studied Saraswatharishtam of multiple classical references. I tried Saraswatharishtam of every company. I get to what I am here now. I was able to successfully treat more than hundreds of patients of speech delays. And this was definitely a hair-raising moment for me. This is why Ayurveda will remain inevitable, and Ayurveda was essential 1,000 years back. Ayurveda will be essential 1,000 years back, and Ayurveda is of pivotal importance right now. And no one can defame how much you want. Tell that this does not have evidence. See that this medicine does that. That medicine does this. Do anti-propaganda as much as you want. You cannot move an inch of Ayurveda. It will remain a pivotal importance in clinical practice 1,000 years back, 1,000 years from now, and now. No matter how much you defame it, how much other people try to defame it.
नमस्ते, मैं कृष्णा पौडेल नेपाल से। मेरे 75 इयर्स ओल्ड मम्मी को डिमेंशिया डायग्नोज हुआ था, और उनको आर्यवैद्य कोटाकल कंपनी का सारस्वतारिष्टम के साथ में उत्पापेश्वर कंपनी का ब्राह्मीवटी दिया गया था। और अभी 3 मंथ्स हुआ है। उनका तबीयत काफ़ी अच्छा है और मेंटल हेल्थ काफ़ी इम्प्रूव हुआ है। इस मेडिसिन के प्रयोग से मैं काफ़ी सेटिस्फाइड हूँ, और डॉक्टर धनावंत को शुक्रिया कहना चाहता हूँ कि उन्होंने अच्छी मेडिसिन की कॉम्बिनेशन प्रिस्क्राइब किया। थैंक यू।
So let us discuss about second case. Second case was a very interesting case. The patient was from Nepal, and I had this very beautiful and very disciplined patient from Nepal who had listened to all my YouTube logical Ayurveda videos, and he came all the way from Nepal to my clinic. And while giving medicines, he also discussed about his mother's conditions. I took some half an hour to listen to what he says about his mother, and I find that she's having dementia or Alzheimer's, a form of Alzheimer's, where she cannot recognize the people that is coming to her home, and she cannot recognize. She's having bad time recognizing the names, and slowly, it is progressing, and she's starting to forget things, etc. So he is telling me this, and he told, "See, I think there is a very chronicity in this disease, and I cannot tell anything for sure." So I told, "See, I'm not confident that I'm able to treat this, but definitely I'll give it a try." So I saw the poor Agni, and I saw the Pitta Vriti in the patient, etc. So I prescribed Bala Gulchadi, Brahmivati, Saraswatharishtam, and Articulationdisorders. To my surprise, within 1 month, she started recognizing people. And this is a new thing even for me. I'm frankly telling you, this is a new thing even for me. And I know people in the world, there are so many people in the world where there are no medicine for dementia or Alzheimer's, where we can reverse this disease at least to a particular extent. And Brahmi or Saraswatharishta or all this Ayurveda formulation is giving a whole new horizon for research. People complain there is nothing to research and everything. Here it is, there is a whole new horizon that is open for treating dementia and Alzheimer's disease, and definitely this is a new thing to me, and that is why there is more to Saraswatharishtam that we know. There is more to Saraswatharishta. We know that potential can be unlocked, can do wonders. There is more to Ayurveda that we know. There are more lot of good things coming which can cure the Sarva Roga of the world. So the third condition is even more interesting. The third condition, I tell you, before I tell you about the third condition, the Saraswatharishta in this particular convulsions, how to give Saraswatharishta convulsions is a thing I learned from Dr. Muralidhar Sharma sir. Dr. Muralidhar Sharma sir is an encyclopedia, is an Ayurveda dictionary, he is an Acharya walking alive. And if you have not watched any video of Muralidhar Sharma sir, you are missing out big on Ayurveda practice. The man has dedicated his whole life to learning of Ayurveda and practice of Ayurveda. There are videos available of his teachings. Please go through that. That is the least we can do to his commitment. And it is wonderful. From his video, I learned that if the patient is having repeated febrile convulsions or any convulsions, give Saraswatharishta. It is going to give a cure or a phenomenal result in the repeated bouts of convulsions. This is what I learned from Sharma sir's video. So I have this kid who is 5 or 6 years old who is coming to me who had repeated convulsions, and she was prescribed everything, Frisium, Gardinal and Levetiracetam, etc. So despite giving all these medicines, she had repeated febrile convulsions, number one. And because of taking these medicines, she is feeling drowsy all the time and she cannot concentrate in anything. The kid is a very cute kid. She cannot concentrate in anything. The parent happens to be a very avid follower of Ayurveda and like a family friend who's a repeated patient to me. So they come to me. One thing is I never stop anticonvulsants in between, because in allopathy practice, anticonvulsants are given somewhere between 5 to 7 years. So stopping them in between itself will cause, it will give fits to the patient. So I generally don't touch that particular area. But in this patient it is different, because despite having that, the patient is having repeated convulsive attacks. So what I did, I gave the patient Vetumaran. Vetumaran is for febrile convulsions. Vetu itself indicates that fits because of fever. So I gave Vetumaran to the patient, and I gave Brahmivati, I gave Saraswatharishta, and I gave this for almost whole 3 months. And I asked the patient, earlier there was a variation in electroencephalogram for this patient, and after giving 3 months of Saraswatharishta, I gradually reduced the dose of anticonvulsants, and after giving 6 months of Saraswatharishta, the electroencephalogram was completely normal, and it is 5 years from now that the patient has been given Saraswatharishtam for 6 months. Till date, I have stopped even Saraswatharishtam, I have stopped anticonvulsants, everything. Till date, the patient did not have a single febrile convulsion, and the patients were very grateful to me. Coming to the beautiful pharmacokinetics of Saraswatharishta, only 2 things are capable of crossing the blood-brain barrier. One is that Grita, one is the ghee, clarified butter, which is able to cross the blood-brain barrier and deliver the medical ingredients to the brain, and another one is alcohol. So Ayurveda has used both Grita and made Saraswatharishtam Mahakalyana Gridam, and it also used an alcohol medium, Saraswatharishtam, to cross the blood-brain barrier and deliver nutrients to the brain and give more blood supply to the brain, thereby curing the disease. And Saraswatharishtam is not only indicated in Vyadhi Avastha, it is also indicated in Swastha Avastha, it is also indicated in Alzheimer's, it is also indicated in Swastha Avastha. It is also can be used for the children who are willing to study more, who are not able to concentrate, etc. You have to just remember that it is potent alcoholic preparation, so obviously it is Ushna Tikshna. So people who have gastritis and gastritis issue, excessive pitta, etc., what I do, I ask them to dilute with more water in Saraswatharishtam, and I ask them to mix half spoon or 1 spoon of A2 Desi ghee. So by that way, the gastric irritant property of Saraswatharishta is neutralized, and they can use it for a very long time, 1 year or 2 years that. And many patients, since I'm practicing since 8 to 10 years, and I've given Saraswatharishta to many patients, and they have phenomenal increase in concentration, especially those who study for competitive exams, etc. Definitely, all over the world, people can use Saraswatharishta. Just that gastritis as a thing and pitta vriddhi as a thing definitely has to be considered while giving Saraswatharishta. There is ultimate pitta vriddhi, then it is better not to use Saraswatharishta and shift to Mahagalyana Kritam or Saraswata Kritam. That would be an ideal choice, or Brahmi Vati would be an ideal choice rather than giving Saraswatharishta. So that is the only point that you should take care of.